Hi everybody, my name is Colt Jansen, and I'm going to be doing a presentation on telehealth in the new age of medicine. What is telehealth? Um, Telehealth, kind of from a higher level, is um, basically being able to phone in via any sort of electronic device, a computer, a phone, a tablet, to a doctor, essentially. Um, the government's definition of it is right here with the use of electronic information and telecommunications technologies to support and promote long-distance clinical healthcare, patient and professional health-related education, public health, and health administration. So it's essentially um, being at a doctor's office, just remote from it. Some of the technologies, as I mentioned before, are video conferencing through use of the internet, store and forward imaging, streaming media, and terrestrial and wireless communications. Um, Up here in the top corner, I had added kind of just a funny picture, in my opinion, but it's reality now. You can go ahead and get on your tablet and you can phone in to your doctor if your health insurance covers this type of um, service. And a lot of health insurers now do cover it because it's a lot of cost savings, which we'll get into later. Just to touch base real quick on some of the providers of telehealth, the majority are major private insurers, and some are uh, in the Medicaid situations where on certain occasions there might be people that are on Medicaid that will be allowed to use some of the telehealth services. Some of the really big ones currently are Teladoc and ARP and Cisco. Um, these right here are probably the big three right now from what I've been able to find. And they're all a part of the American Telemedicine Association, which right here, uh, it just issues kind of what they're about, what they do, and who they do it with. Um, and this is what helps kind of create the background of what telehealth is supposed to be for that industry. And they kind of help set some of the industry standards for the major private insurers and some of the Medicaid situations. Who offers telehealth? Private companies, government agencies, such as Medicaid in some instances, and private individual health insurers, which is, those big ones that we talked about on the last slide. The thing about telehealth is that the top funding sources for those programs, a lot of them come from private payers and then corporate support. Um, so those are the big companies, that go ahead and provide that health insurance. So if you work for a big company, such as myself, I work for Dover Corporation. They have a big health insurer, which is Blue Cross Blue Shield, and they actually offer um, Teladoc, which is one of the services. A lot of companies are doing that now because it saves a lot of money for these companies to use a, um, you know, telehealth service rather than paying um, deductibles and so on and so forth at a physical doctor's office. A few of the advantages and benefits of telehealth are that it creates value for payers, patients, and providers, increased patient access, enhanced reach of healthcare services, reduced cost structures, 24/7 coverage, and higher customer satisfaction. All of these benefits or perks of using telehealth are important because you know you're reducing costs, you're increasing how happy people are with the services that are getting provided, and you're able to offer more to your customer through the enhanced reach, let's say, of healthcare services. And that's a big one because a lot of people have a preference for specialists, and if there's specialists available, then you're going to be able to utilize that within your business. And I think that's one of the big players to helping telehealth or telemedicine advance and grow technologically, and also um, just in general in the market segment. Some of the disadvantages of telehealth are, namely the technology expense. If you don't have access to a smartphone, a computer, a tablet, you can't utilize this, and technology can be expensive. I mean, you're talking a few hundred to a few $1,000s for the services, and that doesn't even include some of the equipment, which I actually pictured here. Um, those are monitoring devices that are mobile, that work through your Wi-Fi, Bluetooth, etc., to provide data to these service providers. Um, Another disadvantage is there's no in-person face-to-face consultation, so that can kind of be a struggle. Some people like to be, in person with their doctor rather than talking uh, via Skype almost. Um, it's not always doctor specific, so you don't always get the same doctor, which some people dislike because they like to have their same doctor they go to for everything, who knows them, and they, have a special relationship rather than a random doc in a box, um, or doc in a tablet or phone that is going to go ahead and treat you. There's only certain cases as well that telehealth can actually help provide services for. They can't provide services for um, treatment of cancer or diagnosis of cancer. Whereas they can go ahead and say, you have a cold or you might have the influenza, so let's go ahead and get you a Z-Pack, for example. Lastly, there's no prior in-person consultations required based on state. So, you know, with the Affordable Care Act going through, there was kind of a provision in there that you needed to go see your doctor before you could get a prescription. Well, now you can kind of take a different direction step. You're still going and seeing a doctor remotely, but still you're not actually going in person. And that's kind of a little bit of a violation of that Affordable Care Act provision slash the general ethical sense of what you need to do in order to get the medicine that you need. Some of the ethical implications of telehealth, as we mentioned before, regulations, provisions, um, all of those different things take place, and telehealth doesn't really have that yet. So, standards and regulations, they apply, but they don't apply yet to telehealth because it hasn't been resolved yet. Um, Getting the people you really need, so specialist wise, are you going to really get the person that you exactly need, such as a ENT, an ear, nose, and throat doctor, when you have a cold? You might just need a general doctor, so you may not be 100% sure of who you're getting and how they're going to diagnose you. Personal professional care. So if you have a family doctor, that's one thing, and they kind of understand who you are as a person and how you act and how you typically handle your health care. Whereas if you get a general doctor that you've never met before and you're talking to them through your mobile phone, there's going to be a different kind of understanding of how to treat yourself and how you treat your body and what your personality is, even. And then long-term usage of telehealth services. Is it sustainable? Can you use it all your life? Or is it something that, you just use when you get sick that one time and it was just convenient rather than going to the doctor? Some of the trends in telehealth are, I actually found a site where there was 7 of them that they list off. Increasing acceptance of telehealth as a standard of care. So a lot of places are actually going ahead and thinking that telehealth is a reasonable way to take care of patients. Number 2, reduced reliance on reimbursement models. So this is an easier way to go ahead and effectively bill clients and or charge them for the services, whereas it might be hard in like physical hospitals. 3, international collaboration. People now can um, go international and maybe even have a doctor in Australia when they need an x-ray reviewed rather than waiting the next day. Number 4, peer sharing instead of hub sharing. Now hospitals can look to one another for information rather than having a central hub dictate what information they get. Mobile health, you can get healthcare through your phone, through your iPad, as discussed previously. Virtual medical centers. Now, virtual medical centers are popping up throughout the world, actually, where people, doctors, as in people, go and kind of congregate and provide services to clients um, through the mobile health devices that you use. And seven, new remote clinical services. So now these services can be provided um, mobily or remote from the doctor's office, such as maybe influenza shots or updated shots that you might need. So when thinking about, you know, I guess recent events that have impacted telehealth programs, with the hurricanes coming, a lot of the telehealth providers and telemedicine providers actually went ahead and used the opportunity with Hurricane Harvey down in Texas as a way to go ahead and show how effective and useful telehealth is. I had put a kind of a little blurb right here from an article that I found on fiercehealthcare.com. And it was really good, and I really recommend reading it. It talked about how they went about doing this and what the impact is on using telehealth in a situation like a hurricane, where people have limited, access and availability to doctors, and a lot of people could be really hurt. So I really recommend reading it, and it was an effective tool to use. And a few of these tweets, actually, from these telehealth providers, um, kind of shows, hey, we're there to help free non-emergency medical care, and here's our numbers, and here's how to access us. So take advantage of it when you can, because you know other facilities and stuff may not be available, and we're going to go ahead and help you get the care that you need in the time that you need it. Finally, just some thought-provoking questions. And these are just to get you kind of thinking yourself, like, is telehealth maybe the right thing for myself? So, do you trust telehealth services? Uh, would you use a service like this in your everyday life, or do you prefer face-to-face experiences for your healthcare? Do you want to go to your personal doctor, or do you want to meet somebody random through your mobile phone? Is it a serious case, or is it something just general like cold, which you feel comfortable with discussing with general MD? And what are some ethical issues you might find with this industry? Do you find anything kind of a little bit iffy or shady to a degree with how things are handled, possibly? Or are you okay with it? Lastly, here's some sources that I used to find some information on telehealth and providers of telehealth. Feel free to look at them. Highly recommend it. It'd be a good way for you to kind of understand what it is in more, terms of your own health insurance and your own health. Um, so thanks for tuning in to this presentation, and hopefully you decide to use telehealth in the future, or maybe you're still comfortable with going to the family doctor. Thanks.